Hi, I'm Dr. Dan Rubin with Ad Hoc with the Doc. I'm here with my close colleague and friend, Dr. Melissa Coates. We practice together at Naturopathic Specialists. We are both board-certified naturopathic oncologists, and we're here to talk about a recent publication in the Journal of the American Medical Association Oncology. It was published July of 2018, and the title of it, because I have it here in my hands, is Complementary Medicine, Refusal of Conventional Cancer Therapy and Survival Among Patients with Curable Cancers. The take-home message from this article was that people who engaged in complementary medicine were more likely to decline standard of care conventional therapies. And those who declined those conventional therapies were more likely to die at 5 years or before than those who actually didn't use complementary medicine at all. One of the types of complementary therapies mentioned in the discussion section of the article was naturopathy. There's a difference between naturopathy and naturopathic medicine. Classical naturopathy is actually a term reserved for non-physician practitioners who are not licensed by a board and who are more folk practitioners. That was a reclassification that happened several years ago by the World Health Organization. The term naturopathic medicine or naturopathic physicians is a term utilized and explains treatments or advice given by a licensed naturopathic physician. We're licensed naturopathic physicians. We graduated from a naturopathic medical school. We hold a license to practice naturopathic medicine in the state of Arizona. And both of us are board-certified naturopathic oncologists. We are certified by the American Board of Naturopathic Oncology and have earned that designation. And so the take-home message that we want to talk about regarding this article is that anybody who is fighting cancer or surviving cancer or is being treated for cancer needs to be under the care of somebody highly, highly skilled in the principles and practice of oncology. Conventional medicine is well studied. It is more well studied than naturopathic medicine when it comes to the treatment of tumors. The treatment of tumors, does the cancer go away? Does it reduce? Do people go into remission? That's a description of an effect a treatment had on a tumor itself. Naturopathic physicians, naturopathic medicine, naturopathic oncology, we do not have as robust number of studies. We don't have the vehicle to produce that. So the issue is that as a naturopathic oncologist, I and Dr. Coates, we've both chosen that as our specialties. In the state of Arizona, we can refer to ourselves as specialists because our specialty is recognized by the Arizona Naturopathic Medical Board. I sit on that board. That said, we're here to talk about the importance of choosing a skilled practitioner. Now, when we see patients, we understand most of our patients have seen a medical oncologist or a radiation oncologist or surgical oncologist. And I know in this article, one of the biggest cohorts of people that were discussed were people who were surgical candidates, but for whatever reason, based on whatever practitioner or non-physician level practitioner they saw, declined surgery. And I can tell you that in our practice, I'm a big fan of surgery, especially when it comes to breast cancer, where if you look at just the clinical data coming out of this clinic, and what I mean by data is I've been working in this field for 21 years now, and you understand where there's limitations of both conventional medicine and naturopathic medicine. I think the skilled physician understands what cancer is, understands how it's treated, understands what it means to have cancer, the current research, testing for it, sort of how to look over the long term over a treatment history, what statistics are, and then can sit down responsibly with a patient and discuss options. And if a patient in this clinic at Naturopathic Specialists, we field many questions from many people, oftentimes who are referred here by our conventional colleagues if a patient has at least an initial refusal to undergo conventional medicine, or maybe it's more of an apprehension and they kind of want to find out choices, or they really want to talk to us and talk about what our experience is in the co-management. And if they do conventional treatment, whether it's surgery, radiation, a biological, chemotherapy, and immunotherapy, and how we can co-manage around that. And then we also have the instances where people have tried those medicines diligently and really gave it a go, and those medicines may be too toxic. They can't tolerate it. And they have discussions with their current conventional oncology team. And we have those open discussions too, and we may treat those people in a co-management setting. Mm-hmm. And so the idea is selecting a practitioner who has the appropriate skill, training, designation, and that can really discuss at the highest level of discussion options and what it means to go through integrative or complementary therapy, what conventional therapy is, those types of things. I mean, you see this in your practice.
Yeah, and one thing I like to add is I feel like sometimes people think if they go see a naturopathic physician that they're choosing one or the other. And yes. I know you've mentioned many times now in this video that, we're integrative here, but whatever the path is, I mean, sometimes I'm actually telling a patient, it's in your best interest to go have surgery or to consider this chemotherapy because, yes, it may be very much in their best interest. So you're not choosing one or the other. If you walk through our door, if anything, you're choosing both, possibly. Safely, and we're going to make sure that we help with your side effects if you choose to do chemotherapy or radiation, or if you're having surgery, we help prep your body and your immune system to make it through that successfully so that you have better outcomes. It's not a one or all or nothing type of a situation, and I just want that to be clear because I feel like sometimes these articles spin it that people abandoned ship and they just went to naturopathic doctors and they didn't get any other care. And that is not the case here when you're going to a specialist who understands the intricacies Absolutely. Of cancer, because it takes a lot, and it takes a lot of angles and treatments to figure out how to fight.
Absolutely. You talked about safety, and you also brought up another good point, is that we don't know which practitioners these patients in this that were studied saw. We don't know if they're board certified naturopathic doctors. Yeah. We don't even know if they're physicians. Yeah. Physician level. They could be lay practitioners who have no skill in oncology but have heard something or read something, or these patients could have been scared and something that was told to them by a family member or friend and they opted out of conventional therapy. I mean, oftentimes we have people that are apprehensive to take a chemotherapy, let's say, because they had a family member or a dear friend that didn't do well on what they're calling a chemotherapy, but when you find out what the medicine was and what the situation was, it wasn't nearly the same situation, and maybe it wasn't even a chemotherapy. And so one of the highest precepts of naturopathic medicine is called dokei-rei, or doctor as teacher. And actually the initial dictionary definition of doctor was teacher. And it's sort of been lost a little bit along the way, but I hold that as a very high precept. And the way we do things here at Naturopathic Specialists is we're so interested in the evolving education of our patients, and we always are here to service them and to answer their questions, asking them to even prep questions and send them to us even before their follow-up visit or something like that. So. Yeah.
Today I got that comment actually in consult that I took the time to go through the labs and explain what they were. And I had a patient who had already been through conventional therapy before, and she's like, no one ever once told me what my lab said.
You educated them.
So we take the time, to make sure that that all of your options and your choices.
And the other thing to think about, and I know we've broached this subject many times with patients, is we are very open and transparent with our protocols. We like to send our notes to the other physicians if requested, or if call them, the other management teams, whether it be conventional oncology. We are participants in the greater community of oncology globally, and we welcome that. And we are here for safety. It's why we're naturopathic oncologists. This is what we do. It's our expertise and our specialty. If you're interested in seeking what can be termed complementary medicine or alternative or integrative, it does come down to semantics. And it is something that if you're interested, these are not things you should take into your own hands. You should not be getting advice from the health food store clerk and not discussing with somebody at the level of a physician. This is physician level stuff to discuss. It doesn't mean that a patient can't go see somebody who's skilled in acupuncture. And many acupuncturists are physician level anyhow, right? But it means that from a biochemical and a medical perspective, if it's medicine that's involved, medicine, something given IV, something given orally, a medical treatment that's applied to the body, that's where we come in and seeking out somebody like ourselves at Naturopathic Specialists here in Scottsdale, Arizona. we have a strong team here, our naturopathic oncologist. It's just strictly advised.
Well, and you have to be careful too, because a lot of people go on the internet when they're diagnosed with cancer and they read what's good for cancer, but it may not necessarily, number one, be safe, or if they are choosing a conventional therapy, it may actually be contraindicated.
Absolutely.
And there's many times where I've had people come in with this beautiful bag of supplements that they think they're helping themselves with, and I have to tell them to stop taking half of it because it actually is contraindicated in what they're doing currently. And they're like, oh my gosh, I didn't know. I just heard it's good for cancer. And that's the thing, is it's such a fear-based thing that you want to go on and help yourself immediately, but
Right.
you need to talk to somebody to make sure you're making the right choices.
Right,
So.
great point. Great point. Because the internet is so readily available and because this information is out on the internet, many people may have seen this study. One of the points of most studies too is that more research is needed in the area. And it's true, this is a really strong interest of ours, is more research in the world of integrative medicine, naturopathic medicine. We're participating in this.
Yeah, there are a few clinics across the United States as well as in Canada that we have joined forces together to basically gather the data from our patients who have done naturopathic medicine as well as conventional therapies, and combining them so that we can get the data to show exactly, what are the outcomes? How does this work? Do people live longer when they do this together? Which we feel obviously that it does help, but we want to have the data to back it up.
Yeah.
So we're excited to be a part of that and helping the future figure out the best decisions.
Excellent. For Ad Hoc with the Doc, this is Dr. Dan Rubin and Dr. Melissa Coates.